Hello, Guyana. I know everyone has been in excitement mode with the wins so far from our West Indies team. We are bringing to you yet another edition of the Health Ministry's Week in Review. On Friday, June 7th, the Health Minister, Honorable Dr. Frank Anthony, visited Region 8 to conduct several initiatives. While on the grounds, he conducted a site visit to the Cato Hospital construction site to assess the progress of the works being done. He then visited the Cato Cottage Hospital, where he conducted a spot check at the facility to ensure services being offered were of the quality and standards set by the Ministry of Health. Thereafter, they attended the launch of a malaria mass net distribution campaign aimed at reducing the transmission of malaria by providing a barrier against mosquitoes that carry the disease. Minister Anthony noted that over 6,000 bed nets are expected to be distributed across regions 1, 7, 8, and 9 as malaria remains endemic in these areas. He added that a recent survey found malaria to be epidemic in the mining areas.
One of the studies that we have done is to see whether there's a correlation between the activities that people do and the increase in malaria cases. And what we found is that in mining communities, we have seen a corresponding increases with malaria cases. And when we examine what is happening in mining communities, we know that generally people go dig up the place, they're looking for gold, and then very often when they dig the place up, they don't fill back the place. So what you have just done there is create a breeding site for malaria.
Thereafter, the health minister and team attended an appreciation ceremony to honor several healthcare workers of Region 8 who dedicated their time and service to those affected by the May 2023 Maria Dome fire. In expressing gratitude towards the healthcare professionals for their unwavering dedication and selflessness, Minister Anthony acknowledged that there is still a need for healing and support for everyone who was affected by the tragedy. Concluding the day's activities in Region 8, 35 students from across the region graduated as community healthcare workers, making them the first batch in the region. Minister Anthony expressed his satisfaction that the graduates were trained in first aid, heart disease, CPR, and telehealth.
At level 1 and 2, one of the things that we've decided in the ministry is that we must be able to offer at least 115 different interventions. I'm also very happy that we were also exposed to a little bit of telehealth training. And why that is important is because we are now using a lot of telemedicine equipment to be able to lift the quality of care that we can do at the primary level.
On Monday, June 10th, Region 5 received a new digital X-ray unit at Fort Wellington Hospital. Funded through the World Bank, this state-of-the-art unit, valued at $97 million, is expected to significantly enhance imaging services within the region. During his keynote address at the event, the health minister highlighted the transformative impact of this initiative on the healthcare sector. He further emphasized that the new unit will deliver better quality images while reducing radiation exposure. Meanwhile, on Wednesday, June 12th, the Ministry of Health made an historic move by launching a national hepatitis guidelines and laboratory strategy. Developed in collaboration with PAHO WHO, the hepatitis guidelines will enable Guyana to implement comprehensive screening, prevention, and treatment protocols to effectively combat hepatitis C, while the laboratory strategy aims to create a comprehensive and integrated medical laboratory system in Guyana. Speaking at this significant event, Minister Anthony noted that with adequate laboratories across Guyana, the strategy will aid in capturing the standards needed at different levels. Touching on the hepatitis guidelines, The health ministry noted that before treating patients for hepatitis C, the ministry had only been diagnosing and educating those who tested positive. He added that with PAHO's funding, the ministry is now able to treat patients. This wraps up this week's highlights. Stay tuned for more updates next week.